Also new from quantum, and perhaps the slide that I'd want you to think most about, and the one that when you get this afterwards you should take home with you and look at, is the quantum leap. The quantum leap carries rather important sound effects with it. So, yeah, watch me do that again when I say it. Anyway, uh, is our strategic impact framework. It's our own, in a sense, internal logic model that we spent a lot of time developing over the last year or so that our board has approved, which really details the 40 measures of success that we're looking for in our grant-making portfolio. Which means that at this stage, if I were writing an LOI to the Quantum Foundation for funding, and I have done that in the past, I would not be writing it without finding one or more of the 40 measures of success to speak to and to share for the proposal that I'd be promoting. So right now, if personally, when I review LOIs, if I don't see direct alignment with this measure of success, spelled out in specific terms for this given population in this given area. Again, our measure of success might be a little broader. You obviously can be narrower. Then chances are it's not going to get funded, and it's not going to get far enough to be seen by the folks who will be doing the funding. So really pay attention to the quantum link, because all grantees have got to link their programs to our success measures as part of the evaluative and the application process now. Also new from quantum is our website. The Grant Center on the website has all of the information that you need in order to seek a grant. As Leslie mentioned, we're entirely online in grant seeking right now. You don't get to start the process by saying, hey, Paul, I got a great idea, and does this start the process? You don't get to send us a letter and say, but I sent you that letter 6 months ago. It really is all through this online process, and we're very helpful and will continue to be very helpful. Content's regularly updated on our website. I do want to come back to that blog in a second, though. Anyway. Come on. And you can call us, email us, schedule an in-person visit. We're Gold LEED certified. We're very proud of the building, proud of what we've done. And that is the broad overview of what we're about. Now I want to say a couple things in conclusion. And that is, number one, in many respects, the worst of the crisis is over for the people who are up at the front of the room here. None of us are in a position with our assets that we were in a year ago, but all of us are in significantly better shape than we were in 3 months ago when we had one of these. And we really think, from everything that you see, that no matter what the summer doldrums for the economy might be, and we're seeing that in the stock market during the month of June a little bit, that the markets are recovering. Investment opportunities are recovering. And so we will have opportunities. We're going to be around. We'll have opportunities to work with you and to be able to address some of the critical needs that exist in our community. However, it would be naive to say that we are anywhere beyond the beginning of what amounts to the real crisis for people that we all care about in Palm Beach County. I don't know how many of you saw this, so I'm going to actually ask for a show of hands about the news that was out from the healthcare district that hit the papers and disappeared almost as quickly from our local papers 3 weeks ago about the deficit of the healthcare district. How many people here are familiar with that? Because we all need to be. One of the reasons why I said I want to come back to the blog at the end is because I did put up on my blog last week a discussion of some of the cuts that the healthcare district is considering to close a $54 million deficit. Now, the healthcare district is a safety net health funder in Palm Beach County. We are, I believe, the largest of the private safety net private healthcare funders in Palm Beach County. Their deficit is 10 times the amount of annual grant making that we do. Let me say that again. This year's projected healthcare district deficit, the gap they're closing, represents 10 times the amount of money that Quantum Foundation can put into the community in the coming year. So 3 times, 10 times what we can put in, $54 million. On that cut list from the healthcare district are cuts to trauma services at St. Mary's Hospital in Delray, the 2 trauma centers that are supported. 25% increases in premiums for people over the age of 55 who are on the Vita Health program. An $11 million built-in deficit at the new Lakeside Hospital in Belgrade, an $11 million deficit in a private facility that would be sufficient to close the doors of that hospital the day that it opened. But it's an $11 million deficit that we as taxpayers are going to be running in our taxpayer-financed, our taxpayer-supported hospital in Palm Beach County the day that it opens. That's the projected deficit for the first year. There are cuts to AIDS programs. There are cuts to clinic services, safety net health services, all on the list. What do I have to say about this? Well, what I had to say about this is on my blog. But what do you have to say about it? Because these are taxpayer dollars. These are tax-funded services that we're providing. This is a monumental deficit. Now, in addition to this, there is a proposed increase in taxation for the healthcare district for each family. The dollar amount's actually rather remarkably small for closing this, because they obviously, I believe, would read into this, perceive that people do not want taxes to be increased, but it's $28 to $39, per taxpayer. Personally, I'd be willing to pay more for safety net services. Some people would be willing to pay less. Some people believe that maybe the system that we're using in order to provide safety net services at the public sector level can't be sustained either, the way that we're doing it now. And I put some of this up there and make suggestions about this, and several people have responded to this blog. Now, well, I have tried to change my blog out once a week during the summer. It was more often than that. And so you'll find a lot of things on the blog, like a really good recipe for chocolate rice pie, if you haven't seen it already. So you find a lot of things on that blog. In this particular instance, I left it up for a longer period of time. And the reason I left it up is because I wanted to say something at this meeting about this, because while you came to hear, in part, what we could do for you, I'm here to ask, because there are a couple of hundred assembled people in the room, for us to think about what it is we together can do for us all. There are more opportunities in the manner in which we deliver safety net services and in the funds that are amassed through taxpayers in Palm Beach County than we are all able to take advantage of. But we cannot even begin to take advantage of those opportunities unless we all engage in the discussion and the dialogue around them. So I want to encourage you to come to my blog at our website over the next couple of days. This will be the featured blog still for the rest of this week. And give me a response. I don't really care whether you're on my side of the issue or somebody else's side. I don't envy the people at the healthcare district, the job they've got to do. And I know the hard work. I know a lot of personal friends over there and a lot of people I admire the work that they do for all it is that they have to do. But we must have community conversation about where this amount of safety net funding is going. And if we don't have those community conversations, we will have no one to blame but ourselves for the failures of our healthcare delivery system in Palm Beach County. And in a way, we will no longer be able to shirk responsibility for the quarter of the people in that pie chart whose access is abbreviated, abridged, or non-existent because we haven't been able to have the system built nor the political will mustered to do it in the way we should be able to do it in Palm Beach County and the way we need to be able to do it in Palm Beach County, because remember, in Palm Beach County, both the sun and the stars always shine. Thank you.